Lastly, we are going to see the delivery. We know delivery commonly occurs in two ways, either as a vaginal delivery or as a cesarean delivery. A vaginal delivery is called as a normal delivery. Other than that, it becomes an abnormal, which is the cesarean delivery, where it is a low transverse cesarean section. The physician will be making a transverse incision and thereby they expand the musculature, dissect the musculature, they go into the peritoneum, split open the uterus and then remove the fetus and then suture it. Whereas in a normal delivery, what the physician does is, or the gynecologist or the obstetrician does is, they might have to give incisions into the perineal muscles. This is called episiotomy. So they make lacerations. It is a physician induced laceration so that they can remove the head of the baby from the outlet of the pelvis. So this episiotomy is normally included in the delivery itself. There is no separate reporting of it. Okay, you need to understand that. Episiorrhaphy, maybe if that is a special encounter, you can report that as well. Normally episiorrhaphy, or they do episiotomy in order to deliver the baby.